Hi folks, this is Dr. Mike, and I'd like to take a few moments to explain our Medical Exercise Program Director workshop and certification process to you. Now, our MEPD program has been around for a long time, and the Medical Exercise Program Director is the individual who manages, develops, markets, administers, but most importantly, helps to teach the staff members in a medical exercise training facility, regardless of the location. Whether it's in a hospital-based fitness center, it's in a physical therapy clinic, a health club, the MEPD is the leader in the medical exercise training facility. And we need more MEPDs out there because medical exercise training, folks, is going to grow well into the next 2 decades. So let me take a few moments and tell you about our MEPD program. The Medical Exercise Program Director, or MEPD, started back in 1998. It was designed to give medical exercise specialists and post-rehab conditioning specialists the additional administrative skills to manage a wide range of medical exercise training facilities in a wide range of settings. Again, physical therapy clinics, chiropractic offices, hospital-based fitness centers, corporate fitness centers. And what we did, we put together a series of systems that we taught in this program so we could make sure that your practices were successful. So, as you'll see here, these MET systems, we actually teach these MET systems over the course of 16 live webinars that are part of our MEPD program. We also have clinical modules. These are available online as online videos. We have clinical modules that look at fitness in the with regard to the realm of pharmacology, senior fitness, and also ergonomics in the fitness realm. We also look at advanced post-rehab guidelines for the knee, shoulder, and spine. These are actually cadaver dissection videos, so you can get a better understanding of the detailed anatomy of the knee, shoulder, and spine, because as the Medical Exercise Program Director, your job is to actually educate your staff as well as the medical community on the benefits of medical exercise training. We also have a MedFit assessment series of modules. These modules go into great depth with regard to assessment, manual muscle testing, goniometric measurements, how to actually assess clients with a wide range of different conditions. And we actually have regional assessments for the knee, the shoulder, the spine, the hip, the cervical spine, the lumbar spine. So we go into every region of the body, and we have actual forms for you with each one of those regions. So it goes into great detail. We also have a section where we'll talk about the business and marketing plan. You need a business and marketing plan for a medical exercise training facility. This actually is kind of your blueprint as to how you're going to grow the business or grow the practice. Now, the MEPD program is not inexpensive. It's an expensive program. It's $2,200, but we have payment plans available. But let me give you a little bit more detail on our MEPD program. As I said earlier, we have 3 components. We have our clinical modules, as I mentioned earlier. This includes modules on pharmacology for fitness professionals, ergonomics for fitness professionals, essentials of senior fitness, as well as advanced post-rehab guidelines for the knee, shoulder, and spine. Now, these are all self-paced modules, and each one has a series of quizzes that you must complete and turn in to complete the program overall. We also have our MedFit assessment modules. Again, these are self-paced modules. They're online videos. They're very, very detailed, very comprehensive, and they go into assessment procedures for the shoulder, the elbow, wrist, and hand, the cervical and lumbar spines, the hip, the knee, the ankle, foot, and even gait and balance. Each one of them is a self-paced module. It has a video, an assessment guide, and assessment forms, and a quiz that you must complete, again, to actually receive the MEPD certification. And then we have our Medical Exercise Training Systems modules, or our METS modules. These are the live webinars. They're actually presented via Google Hangouts. I'm the instructor for these, and we actually go through the 12 medical exercise training systems components that you must install in your practice to make sure the practice is viable, is strong, and has a good foundation. Now, the key thing with the METS program, as well as the overall MEPD program, is this. You're moving from being a fitness facility to now a medical exercise training facility. There's a lot more detail there. There's a lot more responsibility, a lot more pieces that may fall through the cracks. So we're going to train you how to implement these systems so now you can actually have a strong foundation for transitioning from fitness to medical exercise training. This means now communication with the doctor, therapist, and chiropractor. This means now looking at functional outcome measures. This means documentation and communication, as well as establishing referral and marketing relationships with doctors, therapists, and chiropractors. So we'll go over all of those components in the MEPD program. Now, as I said earlier, we have our MedFit assessment modules. There are 8 video modules. We go over assessment techniques and well as having assessment forms in these modules. These are all self-paced. There's a quiz with each one. They run in from length of 30 minutes up to about an hour, hour and a half. And with these segments, they're self-paced. There's a quiz with each one that you must complete to get your MEPD certification. We also have our clinical modules. As I mentioned earlier, there's 6 videos in these modules. We have a pharmacology video, our ergonomics video, senior fitness, and then post-rehab guidelines for the knee, shoulder, and spine. With these, again, there's a manual with each one, as well as the video. The videos are downloadable, the manuals are downloadable, and there's a quiz that goes along with each one of these modules that you must complete to fulfill the MEPD certification requirements. And then again, as I mentioned earlier, our METS modules. These are live webinars. I'm your teacher for these. And when you register for the MEPD program, you're going to get access to the components we mentioned earlier, as well as access and enrollment in these live webinars. Now, each one of these webinars I will teach. We'll go over practice management systems and how to implement these systems in any type of setting. With each one of these, you'll actually have homework assignments that you must complete. So this isn't just simply watch the video and take the quiz. This now requires that you start to think about how you're going to manage and administrate different facilities and different settings. So we're now going to actually teach you how to implement these practice management systems, but you're going to also become proficient in these areas. So if you're looking at the idea of managing a facility, you want to build your own facility, you've gone through our MES or our PRCS program, now you're looking at becoming a manager or an administrator, then we urge you, take a look at our Medical Exercise Specialist Program Director course. You can go to medicalexerciseprogramdirector.com to get more information. Please check the dates there for our next start of our Program Director course. It runs in length about 16 weeks. It's a very detailed program. And please remember, at the end of the program, you have 2 projects you must complete. Now, in addition to completing all the quizzes and all the homework assignments that go along with our METS program, as well as the quizzes that go along with our MedFit assessment modules, our clinical modules, you also are required to videotape yourself presenting a post-rehab or medical exercise related topic to your colleagues. You've actually got to videotape yourself, because one of the key components of being a program director is the ability to present to other groups, physicians, physical therapists, clients, and also to your staff members. So you've got to videotape yourself presenting a medical exercise training related topic that now proves that you have the ability to be a speaker. Along with that, the second project is you have to develop a business plan for a fictitious medical exercise training facility or practice. So that means you've got to put in all your business acumen, you've got to put in marketing pieces, so now you can bring all of this information together and now produce a fictitious business and marketing plan, which now means you understand how to manage that program, how to develop it, how to market it, and how to move it toward being a successful and profitable practice or successful or profitable facility. So everything that you need to be a medical exercise program director, we're going to go over in this program. So if you would, go to medicalexerciseprogramdirector.com. The need for program directors is going to grow exponentially over the next 2 decades. So get started now. Become a program director. We need you. We need someone out there to manage these facilities. But most importantly, the medical exercise program director is the liaison between the fitness or medical exercise training facility and the medical community out there. So if you've been doing this for a while, you have a number of years of experience, you've mastered managing your clients, but now you want to now become an administrator and build the practice, the program director is for you. So thanks for taking the time to listen. Best wishes building your practice. And again, hopefully we'll see you in our medical exercise program director certification and workshop. Thanks again. Bye-bye.